Good morning, everyone. I want to welcome you here to Mission Hospital. I'm Greg Lowe, CEO of Mission Health with HCA Healthcare. And I'm joined today by our esteemed colleagues from the federal and state governments. We're gathered here today to provide an update on our ongoing response to the devastating effects of Hurricane Helene. Joining me today is Senator Thom Tillis, Senior U.S. Senator for the state of North Carolina, Ted Budd, U.S. Senator for North Carolina, Mike Wargo, Vice President of Emergency Operations for HCA Healthcare, Andrea Palm, Deputy Secretary for the U.S. Department of Health and Human Services, Don O'Connell, Assistant Secretary for Preparedness and Response at the Administration for Strategic Preparedness and Response within the U.S. Department of Health and Human Services, as well as Don Wyatt, Team Commander for the Disaster Medical Assistance Team. Before we begin, I would like to talk about a few housekeeping items. To our media visitors today, we are here positioned in front of our DMAT filled tent, as well as in the emergency department. So I'd ask you to please be cognizant of your backgrounds and what you're filming, just to make sure that we protect the privacy of our patients that are accessing care at our facilities today. Following today's briefing, media will be given an opportunity to tour medical tents, and please do not take photos or videos of patients without their consent throughout that tour. Our community has faced an unprecedented challenge in the recent days, and I want to express my deep gratitude for dedicated healthcare professionals, first responders, and community members who have worked diligently and tirelessly to support all of those needs. Since the storm made landfall, Mission Hospital has been providing full services, caring for a significant influx of patients. We have delivered more than 50 babies and have cared for more than 1,800 patients during that time, providing essential medical care in the face of extraordinary circumstances. HCA Healthcare has mobilized hundreds of additional staff to bolster our operations, including nurses, engineers, security personnel, and emergency operations teams. These dedicated individuals have been working around the clock to ensure the continuity of healthcare services in our community. Earlier this week, I met with Governor Roy Cooper, FEMA Administrator Deanne Criswell, and North Carolina DHHS Secretary Cody Kinsley, as well as North Carolina Emergency Management Director William Ray. We expressed the critical need for resources, and they continue to answer the call for support. The National Disaster Medical System, DMAT, has played a vital role in our response, deploying approximately 375 medical, public health, and disaster response personnel to assist in our efforts. The DMAT teams are operating at Mission Hospital in Asheville and at Spruce Pine Blue Ridge Regional Hospital's facilities in the wake of the regional crisis. These highly trained professionals are providing 24-hour surge support in our temporary medical tents, helping to alleviate the strain on our emergency department. We're also grateful for the unwavering support of our federal and state partners. The collaboration between Mission Hospital, HCA Healthcare, the North Carolina Department of Health and Human Services, the U.S. Department of Health and Human Services, and FEMA has been instrumental in our ability to meet the needs of our community. Despite the challenges we faced, our commitment to providing exceptional care and to our patients remains steadfast. We're working tirelessly to restore essential services and ensure that our community has access to resources they need to recover from this disaster. I'll now turn the floor over to Mike Wargo, Enterprise Vice President and Chief Emergency Operations for HCA Healthcare, to discuss the specific resources HCA Healthcare has mobilized to support these efforts.
Thanks, Greg. HCA Healthcare's emergency operations team deployed in advance of Hurricane Helene. Our emergency operations team deployed in advance of Hurricane Helene, activating our Enterprise Emergency Operations Center in Nashville, Tennessee. We've been supporting our colleagues and facilities in Florida, Georgia, and here in North Carolina. We have over 200 incident support team members deployed on site from across our facilities throughout the United States, and we're supporting with well over 200 nurses on site. Upon our arrival here, we established command with the local facility. We understood the needs and began an assessment to understand the needs of the community, starting with life safety, infrastructure, and operations of this facility. We brought in resources through our supply chain health trust, including heavy lift helicopters, to ensure we had the ability to distribute water, food, critical supplies to all the rural facilities that we have responsibility for. We established a collaboration and communication with our colleagues at FEMA and certainly at the ASPR's office, at the Secretary's office in DC. We've been able to build a collaborative relationship with our national disaster teams, the DMET teams here, as well as Blue Ridge and our DMORT teams that we stand ready to support our community. We're here for the community. Our priorities are continuing quality care within our facility here. We've been able to bring water tankers to bypass the water system. The facility just behind you is fully operational for all trauma care, cardiac care, stroke care, and routine care of our facility. That's our number one priority. We're beginning to look at operations in our remote facilities to augment that as well. This goes well beyond the doors of our hospital. It goes into the community here in Asheville and Western North Carolina. So we stand ready to partner with our state and federal colleagues in all aspects of this to support our community. Thank you for being here, and thank you for giving attention to the community that's in need. Next, I'm going to turn this to Andrea Thom, the Deputy Secretary of the U.S. Department of Health and Human Services.
Good afternoon, everyone. I am Andrea Thom, and I have the privilege of serving as the Deputy Secretary at the U.S. Department of Health and Human Services. I want to thank HCA for having us here today. Thank our Senator Thom Tillis for his partnership and the way in which the collaboration more broadly, as you are hearing, is really meeting the moment to do what we need to do for communities here and across the Southeast. Obviously, I can't sort of talk about our response without first expressing our condolences to those here in North Carolina, across the Southeast, who have lost loved ones, family, friends, neighbors, and obviously we are here for the long haul, as the President and the Vice President have challenged all of government to be for the people here attempting to recover from Helene. I want to just sort of lift up a little bit. You're going to hear from our Assistant Secretary for Preparedness and Response about what you're seeing here and what you will be able to tour afterwards, and sort of put in context the way in which the U.S. Department of Health and Human Services is part of this response. We have declared a public health emergency in the 5 states in the Southeast region, which unlocks a number of things, including from a physical healthcare perspective, the ability for our colleagues at the Centers for Medicare and Medicaid Services to provide support and flexibility to healthcare providers and the healthcare system to ensure that people who rely on Medicare and Medicaid can get the emergency healthcare that they need. Again, you'll hear from Dawn in just a minute, but another part of the HHS family that is leaning in is our ASPR colleagues. You see our NDMS colleagues here. I want to thank them for deploying here to help with this mission, and I'm going to let Dawn dig into some more details there. But that's the physical health part of this. What we also know about situations like this is that mental health is a large concern. The stress of being in a disaster, of having family, friends, relatives who are unaccounted for, the grief that comes with something like this, the financial stress of the recovery, all of those things mean that the way in which we at the U.S. Department of Health and Human Services show up to support the mental health needs of these communities is really critical. And we have deployed our disaster distress mental health line, which I want to make sure folks are ready to get the number for, so that folks all around this state and the Southeast region have it at their fingertips, and that is 1-800-985-5990. That's our disaster mental health crisis line. If you need crisis counseling, if you need to talk to somebody to help cope with what you're dealing with in response to this disaster, we encourage you to reach out and use that resource. I also want to note the ways in which the public health parts of the U.S. Department of Health and Human Services are showing up in this response. We know that floodwater carries all sorts of things, and so the ways in which we help people understand the tools and have the knowledge in a cleanup process generator safety, food and water safety, all of the basic nuts and bolts kind of public health tools that we can develop and deploy to help support communities and families as they're starting to think about cleanup and recovery are really important assets that we can bring to bear, again, in collaboration with our state colleagues and with others around the Southeast. So I just will end where I started. We at HHS are all in to make sure that this part of North Carolina and the rest of the Southeast have what they need for as long as they need it, and we will be here in support of this mission. Thank you again so much for being here today, and appreciate all the work of our partners around the state. And with that, as previewed, I will hand it over to our Assistant Secretary for Preparedness and Response, Dawn O'Connell.
Let that fly overhead so you can continue to hear what we're saying. So I am Dawn O'Connell, the Assistant Secretary for Preparedness and Response at HHS, and I want to join our Deputy Secretary, of course, in expressing our condolences and support for this community. But let me also say, I know how special Asheville is. I know how special Western North Carolina is. I grew up, as we say in the South, down the street, down the road in South Carolina. And as I grew up, we spent summers coming up to Asheville. So I have paddled in these rivers, I have eaten in these restaurants, I have been part of this community. I also have to say, after a fateful trip to Grove Park Inn, my 2-year-old took a tumble off the terrace, and I've been to Mission's emergency room. And it was a wonderful hospital environment, and so I'm so pleased that we've been able to come in and bring our National Disaster Medical System teams to help augment the good work that's happening here at Mission. So ASPR will go to whichever communities are needed, and we do this in concert with our state partners. And since we began to see this storm forming, we deployed our teams first into Mobile, Alabama, and Jacksonville, Florida, as we were anticipating that landfall. But as we often see with storms like this, it's not the initial landfall that creates the biggest impact. It's the second and third order effects. So as soon as we started seeing the impacts here across the Southeast, we moved our teams up. And I'm pleased to say we've got over 300 team members deployed to support our response. We've got the Disaster Medical System team here in Mission. They're from California, and I'm proud of the work that they are doing. We've been able to walk through their tents, and I know that you will be able to too. And just to understand the level of impact they can have, 3 days ago, the hospital's emergency department occupancy was over 200%. Within 2 days, with the help of our NDMS team, the hospital ED is now at 50%. A few days ago, the hospital had more than 100 patients waiting in the emergency department. Yesterday, the hospital had 1 patient waiting to be seen. And that provides a level of care for this community that we are proud to support, but it also allows the doctors and nurses that work at this hospital to take care of their families and their homes, because we know that they have been impacted too. We have a second disaster medical assistance team in Spruce Pine, North Carolina. They're from Rhode Island, and they are providing. That's a good sign. That means support is going out. So I want to pause and let that. All right, so we've got that second team in Spruce Pine, North Carolina from Rhode Island, and they're providing the same sort of care that you're going to see here today. We also have staged and ready to support a national disaster mortuary team to help with the search, the rescue, the reunification of those that have been impacted. They are staged and ready to support with the state of North Carolina as needed. And we recently, I think just overnight, launched our emergency prescription access program. For those that are uninsured, they are entitled to receive free 30-day supply of the prescriptions that they need. So if anyone out there is watching this and you need your prescriptions filled, hhs.asper.gov/EPAP. You can sign up for that program if you're uninsured to receive a free 30-day supply of your prescriptions from participating pharmacies. And this is what ASPR does. You're having an opportunity to see the work that we do. We're honored to work side by side with our hospital partners, with our state partners, and it's important for us to be available. We continue to have teams that you're not going to see today that are taking intake with the state of North Carolina and making sure that there are not any unmet needs that we could be deploying towards. So we have teams ready to go should they be needed still, and as our Deputy Secretary said, we intend to be here as long as we are needed. But with that, let me thank you for being here and for carrying this message forward, and I want to turn it over to the distinguished senator from North Carolina, Senator Thom Tillis.
Thank you all. We want to get to questions pretty quickly, but I think as I watch the national media and as I hear things on social media, I still don't think the full effect and scope of the damage of this storm is really appreciated. We're going to do everything we can to make sure members of Congress are fully briefed when we go back and inevitably have to vote in support of disaster funding. But I just want to thank the DMAT team, the other folks, for having the vision to be here when most people would not have been. We need to keep in mind that the federal government had assets in this area before we knew what kind of a weather event it was going to be. Did we have everybody? No. And the reason for that is it would have defied any sort of historical examples to think that we'd be experiencing the damage that we're experiencing today. But I have a lot of confidence. I want to thank the federal, state and local agencies, first among them first responders. I want to thank Mission Hospital and HCA. Many of you know, if you're from the Asheville area, Mission Hospital is the largest employer here. So at the same time that they're providing critical health care, they're dealing with the circumstances of employees who have devastating situations at home that they had to deal with. This facility allows you to decompress. So while Mission Hospital didn't have power, didn't have water, they were trying to create a way to actually see patients in the brick and mortar facility, but have flex capacity out here, which is desperately needed. Now Mission Hospital has power, and they are piping in about 250,000 gallons of water every day into a pressurized water system. These are all the things that are happening behind the scenes that are taken for granted, that quite frankly, if it wasn't happening, this disaster would even be far worse than it already is. So I want to thank Secretary, I want to thank everybody for coming here, shedding light on this disaster that we're dealing with, and I want the people of Western North Carolina to know we're in it for the long term.
Thank you for those comments and for all the efforts from all of our agencies and individuals and caregivers. We really appreciate that collaboration. I think it's apparent, and you've seen that as we partner with our federal, our state, our local agencies, with private industry, with HCA Healthcare, some pretty incredible things can occur, and we're here for our community. We'd like to open it up for some questions at this time. Back here. If you could please provide.
Look, I've lived in North Carolina for almost 30 years. I've seen a lot of storms come through this state. I'm actually impressed with how much attention was paid to a region that wasn't likely to have experienced the impact that they did. The unique nature of just the sheer land mass and then the unique terrain within Western North Carolina is very challenging. Are we going to score? You never score an ace on a disaster response, but the only thing more difficult than a hurricane response is what we've seen in the western part of the state. We have a certain muscle memory and experience with positioning assets out on the coast because you have time. Here, this was right out of, this is a new playbook for anybody who thinks that any level of government, anybody here could have been prepared precisely for what we're dealing with here, clearly are clueless. They're doing a great job. They can always work harder. There's always kinks in the slinky. We're working them out behind the scenes, but I think we're all here to send a message that we're working together, and I'm pretty proud of the effort that's been done now. Will I be silent in any areas where we can do better? No. But right now, I'm out here to say that we're doing a good job, and those who may not be on the ground, who are making those assessments, ought to get on the ground.
Excellent. We had a question over here.
I just want to add to that. Prior to the declaration, we had direct contact with the State Emergency Operations Center, with our colleagues at HHS and FEMA. From our perspective in health and medical, it was a very timely response. The collaboration ahead allowed us to do the assessments, to understand what resources were needed, so that when that declaration was made and the directive was given, there was zero delay in receiving these assets and these teams. I know the Secretary had mentioned before the decompression of our emergency department. This DMAT and the decompression saved this facility in terms of allowing us to care for our patients. And that quick response is why we are the way we are today. So I really want to emphasize the partnership there. This was a very quick response and a collaborative response.
Thank you.
Thank you.
Yes.
Tony with NBC News. Questions for you.
Yes.
As far as the hospital goes, you feel confident that you have enough supplies for the remaining weeks, months?
Absolutely. The resources deployed by HCA Healthcare and the timeliness of the deployment of those resources was just phenomenal. It was difficult during the storm. We had a rough ride for the first 24 hours, but our teams were on site. We brought additional teams on site to sleep in the facility, to be available to care for our patients around the clock. Those resources started to arrive at our facility almost immediately. Food, water, fuel, anything we needed, and then some came our way through our HCA Enterprise Emergency Management System.
Your employees are fully prepared and staffed and supplied to do whatever is needed?
Yes. The resiliency of our team, the courageous effort of every one of them has been mind-boggling. Not only do we have our current team working, but we've brought in hundreds of nurses from outside the area through our HCA Healthcare partner hospitals that have dedicated their time to come and spend time helping through this disaster. So yes, we feel very confident. The hospital is fully operational. We have city power. We still do not have that vital resource of our municipal water, but we are providing that through what Senator Tillis mentioned, a trail of tanker trucks that are pressurizing our hospital so that we have showers, sinks, everything we need to operate our hospital fully. Right back here.
Saturday was obvious.
Can you please, your news source?
Sorry, Jennifer Emmer with WLOS. Saturday was obviously the worst here. How bad was it, and how have things improved since then?
There was a lot of commotion throughout the storm and in the direct aftermath. But as I mentioned, we were able to maintain power at the hospital at all times through our generators and through the preparation that we had. We had food supplies, we had supplies to last multiple days. We also had the request to feed all first responders, and so we did that. Over 750 first responders were eating with us and sharing stories about the heroic work that was happening within the hospital and within our community. We have become more organized every hour, every day since then, and feel very confident in our ability to care for this community. There was another question back here. Okay, down here.
Jessica Van-Egren with the Milwaukee Journal Sentinel, but now Asheville.
Yeah.
I have questions about what's happening with the patients inside. I had read that like sterilization of tools, surgeries will be put on hold. Is that still happening? Are you able to do that now? And then secondly, bathrooms. Obviously, forced flushing toilets was something that was occurring. How long did that last, and has that stopped?
Yeah, numerous points though. So there was a lot of commotion, as I mentioned, during the first 24 hours of the storm. We lost city water, a vital resource. And so we deployed our entire team to provide buckets of water to flush all toilets. So we had potable water on every unit. Our patients were safe at all times. There was never a time where our patients were in jeopardy, and our caregivers, again, had a Herculean effort to keep all of our patients safe. Since then, and with the pressurizing of our water system, we've been able to have showers, toilets, sinks, and everything available. So at no time were our patients at risk. We had infection preventionists, teams of them, rounding in the hospital, double checking the safety of our patients. We also had industrial hygienists that were here looking at all of our sterilization processing, and all of the different things that we do in a hospital. The resources from HCA Healthcare deployed also mobile sterilization, where we moved sterilization processes outside of the disaster zone, had them sterilized and brought back to appropriately use for our patients. So again, a lot of different things happening in a short period of time.
If I can add to that, we really leveraged the scale of the organization. As Greg mentioned, the sterilization, we used remote facilities that had capabilities. We had the intermediate transport. We had a cache of sterilization trays here so that we can stay open to trauma services, but we partnered with our Health Trust supply vendors in those facilities to maintain that every day, constant supply. The first few hours weren't pleasant. I'll be very direct. When we got here, this is a community that just was decimated. And our job in the beginning was life safety. What are the priorities to care for our patients? How do we support our staff? How do we get additional staff in here to relieve our staff? But the environment at first, we did the best we could to maintain the cleanest environment that we could. It's improved. You go in there, it looks like a hotel right now. We brought the resources in. It is cleaned up. You have all the resources you need. However, we are dependent on a supply chain. We have contingency plans in place that if part of that supply chain fails, we have action plans. What's our next plan? What's our next move? So I want you all to be assured that we are stable, but there are capabilities in play with our federal partners to continue care for our patients, even if there's another insult or disruption.
And just to add to that, our most important asset here at the hospital are our people. And so bringing individuals in to sleep at the hospital, to care for patients day after day, we understand the fatigue and the unique situations that they were in where they may not have heard from their family members. They did not know the status of their homes. So we set up mini marts and mega marts in every one of our hospitals to provide food, water, supplies, cleaning supplies. We set up mega marts where we had tanker trucks full of fuel, where we fueled over 5,000 employees' vehicles to be able to get back and forth to their homes and return to care for the patients in need here in Western North Carolina.
Guys, we have time for like 2 more questions to make sure you have time.
Okay, right here.
What's your
Can you say your news outlet?
Albert at Blue Ridge Public Radio. A lot of people are out in the muck cleaning out their homes, their businesses. What's the preparation for people that might become infected with that muck and that water that was infected? And what are the preparations here for mental health services, for doctors and nurses who are seeing all this traumatic stuff?
Public health?
Sure. Part of our emergency operations program is we have a behavioral health incident support team. So as we deploy folks like myself to help manage the incident, we're now at a point that we bring clinical specialists in, therapy dogs, to spend time with all of our providers, all of our employees, our first responders, that we can to help them decompress and understand their needs. That's also an assessment what the community's needs might be. We'll partner with our state colleagues, our local colleagues, and certain our federal colleagues to expand those behavioral health services to support the long-term needs. Sir?
Yeah, Andrew Jones, Asheville Watchdog. I just want to jump off that a little bit. I talked to 15 doctors in our community yesterday. Some of them are really concerned about the second wave of patients that may become infected with either respiratory diseases or other bacterial diseases as a result of not having water in our community. What's the prep that's happening for that?
From a clinical standpoint, we've got a team of colleagues, physician leaders, nursing leaders, infection preventionists that are really focused on that. This becomes the public health side of things, the long-term side of things. Our local health departments, our federal health departments will come together to assess the needs of the community, to advance resources to support that. This won't be short-term, this will be long-term. We've got to really look to the integrity of the public health system, the hygiene within the community, and offer them water services that are being deployed, hygiene services that are being deployed, and just continue to assess the needs and provide those resources.
Can I piggyback out from Andrew's question real quick?
Again, a news outlet?
The Milwaukee Journal Sentinel, the Asheville Citizen Times. You talk about hygiene out in the community. We've been noticing, we've been seeing, we've been dealing with, toilets in our facility that are still unusable. Porta potties like in downtown Asheville that are routinely filled up to the top. Like people are drinking water because they don't want to have to go to the bathroom, and the porta potties are disgusting. So I know that it might not be this group's job, but how and when is that relief coming in And whose job is that? Because I think there's a lot of people that are working in Asheville, downtown specifically, and it's just a void for those things. And I can't help but think that part of that second wave is because of that. You know, that it's.
Yeah, thank you for that point. So that we're very connected with our local officials and all the relief efforts that are coming in. So I think more to come on as those resources are deployed throughout the community, a little outside of the hospital, and they could provide that. They have briefings at 10 o'clock and 4 o'clock every day. So I think that's probably the appropriate forum to ask that question in.
I think we're close to time. We might have time for one last question.
One last question, yes.
We've heard out in Marion there was impact to Baxter that provides IV fluids to a number of healthcare facilities. What's being done there? And we talked a little bit about like supplies. Are you having problems getting anything? And what's being done to try and remedy that?
Yes, I've been briefed on that. I'll confer with my team and we'll get back to you on that.
If I may.
Yes.
Thank you. So one of the concerns we have at ASPR is on the medical health supply chain. As soon as we heard that there was a situation with the Baxter plant in Marion, we reached out and spoke to the CEO Saturday night. We had our teams meeting for the first time Sunday morning, and we've been meeting daily since then. I think folks know Baxter has been, they provide 60% of the nation's IV fluids, and we are working to, and they are working and have been a terrific partner in trying to find additional supply. They have, fortunately, plants across the world that they are looking to access supply from and bring in to be able to staunch, which is the difficulty right now for them of being able to access their plant. There was a bridge that went out, and that was the bridge that would bring things back and forth. They've been able to, for their industry, they've invested in this on their own, put a rock bridge in to begin to get some of the machines in to help augment and begin to clean up and get it back online. They also had some supply in their plant that they thought was salvageable. They're looking at that to try to get that into the supply chain. But from the federal perspective, we've been in lockstep with them, helping to secure whatever bridge access they needed, and also to look around for additional suppliers who could fill the gap while they begin to ramp back up. But I will say it's a concern of ours, but Baxter's been a wonderful partner in trying to minimize the impact on the supply chain. Of course, we saw the East Coast port situation get resolved overnight. That was an additional pinch that we were worried about. But that's now less of a concern, and we're focused on getting Baxter back up and ready to go. And they've been a terrific partner in all of this and are very concerned about this as well. But we continue to meet regularly to assist.
I would just say to that end, the Food and Drug Administration, also a member of the HHS family of agencies, and as Dawn noted, there are a couple of other domestic manufacturers for some of these products, and we, through our colleagues at FDA, are in touch with those manufacturers about the opportunity for them to ramp up as Baxter is getting itself square and assessing their situation and getting back online and back up to full capacity. But we're, again, pulling all the levers we have at HHS to make sure we're leaning in to support this work more broadly, including our colleagues at FDA.
I want to thank you all for being here. We appreciate and value the partnerships that we've created and we're working through, and look forward to a unified approach to our response. Thank you.
Thank you, everyone. Now we're going to have the opportunity to walk through some of the tents.